Scalpel to syringe, as the demand for more radical cosmetic procedures soars in Wales, so does the supply. But how safe are these nips, tucks and jabs? And how good is the advice on offer? And how much do some of the people offering potentially dangerous medical procedures really know about what they're doing?
If I walked somewhere or whatever to have an operation and it was in a hotel room, alarm bells would definitely be ringing.
I am really worried that if this carries on with beauty therapists doing it, we could have a disaster. It's a disaster waiting to happen.
When you're injecting the most potent poison known to man, it would be nice to know that the person doing that has had adequate training.
If you've got the courage, I would love to have it done, but I don't think I've got the courage to have it done. I'm frightened I'll end up with big cod lips.
I personally wouldn't risk having it done, but I know that a lot of people in my family that are older than me maybe have more wrinkles and may be up for it, definitely.
Cardiff salon Aquarius is one of many hairdressers, clinics and gyms in Wales now offering cosmetic procedures alongside traditional beauty treatments.
In the last year, Botox and dermal filler has become a lot more popular, and I think it's because prolonging the age, feel-good factor, and providing it is administered properly, it does make you feel very, very good. And people, I think, even though that, you know, sort of in this sort of kind of recession, they will find business, they will find money to look after themselves.
I'm the nurse today. What we're going to do is you're going to go through the consent form and everything first.
We normally get our registered nurse in about once every 2 to 3 months, and she's fully booked for a day.
Advanced nurse practitioner Jo Phillips administers what are known as injectables. Botulinum toxin, known by its trade name Botox, reduces wrinkles, and dermal fillers fill out the face.
Personally, I feel it should be a doctor, a nurse or a dentist that should practice with injectables. You need to have a good understanding of the anatomy of the face. You need to know where your veins and your arteries are, the muscles, the nerves. Your face is quite a complicated structure, so you need to have a good understanding of where you are injecting. You'll have a little bit of a scratch, but it shouldn't be too uncomfortable. There are some places, I believe, that will train level 3 beauticians in dermal fillers. I would rather go to somebody who is properly qualified and properly trained.
Campaigners like Sally Tabor from the Welsh Independent Healthcare Association believe the cosmetic business now needs an overhaul.
Well, in Wales we've had examples of beauty therapists giving Botox and dermal fillers, and this really does affect patient safety. If a patient has an anaphylactic shock to a dermal filler, then you need to ensure that that person is having it done in the right environment, in a clinic environment, with equipment that can make sure that they're fine, and they will be fine. But I am really worried that if this carries on with beauty therapists doing it, we could have a disaster. It's a disaster waiting to happen.
Mandy Simmons, a permanent cosmetics beautician, runs B Nails and Beauty in Swansea.
Ladies that do pass through the salon on a regular basis have had droopy eyebrows. Their lips have been overworked, so they have had twisted lips. Some of them look as if they've had a stroke, to be honest.
Mandy became really concerned when she tried out cosmetic procedures herself.
One particular environment was a gym, a room in a gym. It wasn't the cleanest room I've ever been in, and she was very rushed in and out. You know, the form took all of 2 minutes to fill in, and she just seemed to be more interested in the speed of the treatment rather than the actual procedure itself, and taking care and paying attention to what she was actually doing, which showed in my face 3 or 4 days later. So, and she spoke of being a nurse, but there was no certificates available. So, on reflection, I maybe was a bit naive. There's so many Botox parties nowadays where there's groups of women being injected. I don't think the lighting may be appropriate at times. I don't think the concentration levels may be what they need to be to inject certain muscles, and the amounts that they're actually putting in. But is it being administered properly in that environment? That's the question that I would ask, and I would certainly not be part of a Botox party after a few bad experiences.
Okay, if you can do as big a frown there as you want to.
Mandy now goes to a GP, Dr. Steve Bassett, who runs his own injectables clinic. He believes botulinum toxin, a prescription-only drug, can be dangerous in the wrong hands.
As you can see, we're using a very fine 30-gauge needle. It's a very short needle, and we're injecting into very surface-based structures around the skin. So there's not going to be any anatomical damage of hitting any major blood vessels or nerves, as there might be when injecting dermal fillers, where that is one of the major risks. So the only thing that can happen as a result of the injection is sometimes a little bit of swelling, difficulty with bruising, and sometimes a bit of discomfort or itching. However, once you admit that a treatment is potentially safe in skilled hands, it's very easy for others to then draw the conclusion that it's also fairly safe in unskilled hands. And relax.
But injecting botulinum toxin can be far from safe if the proper guidelines aren't followed.
It can quite easily cause problems with eating, drinking, speaking, and the ability to form shapes correctly around the mouth. And again, if it's used in the neck, there have been cases of reported serious toxicity and, in fact, cases of cessation of breathing and cardiac arrest.
Dr. Bassett's next patient is coming for a different procedure.
Hi, Claire.
Hi, Steve.
Pop up. Yeah, that's great.
I'm having fillers around this area. The reason why I'm having it done is that, I just feel that it needs a little bit of volume. Over the years, obviously, you get to look a little bit older.
Reduce that.
But it's dermal fillers which are of the greatest concern to medics like Steve. These can be administered by anyone with little or no training.
There's a small area right at the corner of the nose where there are some important blood vessels, and it's quite tempting visually to inject into that area to expand it, but nicking or snagging, catching that blood vessel can lead to some serious problems with the skin actually becoming necrosed or dead in this area. Dermal fillers are considered to be medical devices, but the regulation on the production, distribution and administration of medical devices is, I think, quite slack, and consequently anybody can administer a dermal filler without any degree of training at all. That does concern me because the potential hazards for dermal fillers, as I've said, are much more significant than they are for botulinum toxin.
A Department of Health review of the regulation of the cosmetic procedures industry is due to report next year. Meanwhile, experts are starting to scrutinise who should administer injectables.
We really need to look at who is providing these types of treatment. They are medical procedures. They need clinical operators. I think the idea that somebody can be doing it in a corner in a hairdresser's or a beauty parlour really needs to be rethought.
Have a look at that.
The General Medical Council has recently banned what's known as remote prescribing. So now a medical practitioner must see a patient in person before they prescribe for them.
Thanks, Steve.
As of right now, the regulators have all said there's to be no remote prescribing. So with changing the packaging of dermal fillers and making sure there's no remote prescribing for Botox, because often Botox and dermal fillers are given together, then I hope that we're going to stop some of this poor practice. The minister in England, the public health minister, Anne Milton, has supported that beauty therapists are not appropriate doing cosmetic injectables, and we have a statement in the Habia, which is the hair and beauty industry magazine, to that effect.
Currently, beauticians are able to administer dermal fillers. Sally Tabor represents Treatments You Can Trust, a self-regulation scheme working with the Department of Health to create a meaningful kite mark, ensuring good standards of practice and training.
We want the public to only go to a clinic that carries the Treatments You Can Trust logo. or a practitioner that carries it if they are a mobile practitioner, although we need to make sure that they are doing it in the right environment.
I think the training side of it does need to be looked at. There's a huge variety of training, from very half-day courses to really proper training courses. I think that one of the things that is being looked at is sort of a kite mark for training courses, so that when you're choosing as a consumer, that you're choosing someone who's been properly trained and that has been through a really rigorous training process.
I've been in a situation where I've been in the hairdressers and seen other people having it done in as far as I'm concerned, a less safe environment. So that's why I've come to Steve. He's a GP. I trust what he's saying.
But there's one area of the injectables industry resisting effective regulation. Journalist Carolyn Hitt is worried by the proliferation of DIY products available on the internet, including tanning product Melanotan, which is banned from over-the-counter sale in the UK.
Well, to give you an example of something that is totally unregulated, and it comes with a syringe, not particularly, it says sterile insulin syringe for single use. This is Melanotan, injectable tan, which you can buy from the internet. I have no intention of using this, but just to show how easy it is to get it, you can get it off the internet. And I spoke informally about this to a beautician. She told me she knows a couple of the girls in the valleys who use it. Then they got pregnant, so they didn't use it anymore, so they were halfway through a kind of series of injections, and they ended up looking like Dalmatians with this kind of very patchy skin effect. And you just think, well, you're putting the substance inside your body. You don't know anything about it. You don't know who's administering it. All to get a golden glow, when you can just go into a shop and buy some fake bake, for God's sake, if you're that desperate to look like a cuprinol-coloured fence.
Terence Hughes, who works in the cosmetics industry, has tried the DIY approach himself, injecting botulinum toxin he bought off the internet. He's gone one step further, having major surgery abroad.
To have it's called an S-lift, which is a soft face lift where they cut you here to here and then pull you here, and that's very good for these lines here, very deep lines, and it got rid of it.
Terence also had fat removed from his stomach and placed in his cheeks. He says his desire for surgery stems from a mental health issue called body dysmorphia.
Body dysmorphia isn't about vanity. It isn't about you look in the mirror and you think, I look really good today. You look in the mirror and you pick faults and you see the worst case scenario. So you see a distorted image of yourself. And it's something which will never be fixed. So you have one bit of surgery done and you have dissatisfaction coming about something else. So whereas you'll see a line here, you get that fixed and then it will change to something here, or it will change on the body, or it will change on something else. It came from being bullied. So from about the age of 7, being bullied at school and being taunted at school for how I looked. It's quite a lonely place sometimes, because sometimes I don't even feel like I can get up and go out, because it's what I see is so ugly.
Terence remortgaged his home to cover the £12,000 cost of all the procedures. It might sound extreme, but he isn't alone in seeking out surgery. According to the British Association of Aesthetic and Plastic Surgeons, the number of procedures has been higher than ever in the last year, up 6%. Industry experts are worried about the implications.
In the last few years, we've seen a huge growth in commercial clinics and commercial organisations that have come into this business place, into this marketplace, and obviously, as a business, they've come in with the sole aim of making it profitable, and that hasn't always been in the best interests of the patients.
Kevin Hancock works in both the NHS and private practice. He supports the increasingly vociferous calls for the industry to put its house in order.
It is clearly very important that in our initial assessment of patients, we do identify people who are looking for inappropriate operations or who are, we would consider, have unrealistic expectations. So we now very much have the situation where advertisements and commercial clinics are suggesting get a new hairdo, get a new pair of shoes, get a new pair of breasts. And really this kind of shopping list and trivialising of what are, at the end of the day, serious surgical procedures is one of the biggest areas of concern that we have.
For now, Terence feels his surgery has had the desired effect.
If in 5 or 10 years' time I wanted a facelift, I'd have one. So I'm not discounting it, but I'm not having any more done now. You know, there's a desire to see myself as actually as I am. And that's what I like, to see myself as I am.
Ex-Big Brother contestant Lisa Janes runs her own beauty and nails business in Cardiff. Last year, she was unwittingly drawn into an international medical scandal. After adverse media reaction to her television appearance, Lisa decided to have surgery on her nose, but it didn't end there.
It is addictive because I think once you have one thing done, you start to find faults somewhere else. And I did have Botox, I did have my lips enhanced, I was getting spray tans, it was this whole image thing that was going on. My looks had to be perfect.
In 2004, she had breast augmentation done privately.
I was actually told by the surgeon it was the equivalent of like a jelly baby. When you bite a jelly baby in half or break a jelly baby in half, the inside stays in where it is, so therefore it can't leak and can't do you any damage.
About 4 years later, Lisa became concerned that her breasts had changed shape and went to her GP. She was one of hundreds of thousands of women worldwide to have received faulty implants. They were made of substandard industrial-grade silicone and supplied by a French company called PIP.
Psychologically, it was debilitating. I was falling apart. It was very, very worrying time. I wasn't sleeping, I wasn't eating, I wasn't resting.
Many clinics were not prepared to replace implants free, and last year the Welsh Government took an unprecedented step. It offered women not only removal but also replacement of the implants on the NHS. About 1,000 women took up the offer, including Lisa. Today she's back at Morriston Hospital to check the results of the operation.
It was a big operation, it was nearly a 2-hour operation, so it's, you know, a massive trauma psychologically and physically to go through. And I just like to know that all of this is over now, that I don't have to worry about having defective implants leaking into my body anymore.
OK, Lisa, we've had a look at things and everything's looking quite good at the moment. It's 2 weeks after surgery.
NHS Wales has been handling the additional strain on the services set up primarily to do reconstructive plastic surgery for burns and cancer sufferers.
Do you want to see it now? Do you want
That's the PIP.
The PIP implant. This is the leak.
I'm absolutely horrified that that was in my body, and now it actually, seeing it has made me realise why I had the symptoms I had. Because, like Mr. Katara said, that was what was causing all my pain.
In June, an NHS review concluded that the PIP implants were substandard but did not have long-term effects on health.
The whole PIP issue has opened up a whole can of worms, and I think an awful lot of people have been surprised at actually how little information is shared between private providers and the NHS, and actually how little regulation there is of the products that are used in this whole sector. And I think that because we've now found one thing that went very badly wrong, I think it's clear that we need to sort it out so that it can't happen again.
A lot of patients just didn't know what sort of implant they had, and if their clinic had gone out of business, there was no record of that. And so having a central registry would immediately allow a particular product to be identified in this population.
Lisa has been giving online support to other women affected by the PIP scandal, but what of her own situation?
I'm over the moon with the result that I've had today, and I can have my life back now.
There's increasing concern at marketing methods being used by some in the industry.
Too often, some of the clinics who have been responsible for this problem are advertising in a way that encourages patients, mostly women, not to perhaps give the due thought. So some of the incentives, like, buy one, get one free, pay cash, get a discount. If you can have it done tomorrow, we'll do it for half price.
It isn't something that if you don't like it, you can have it changed back tomorrow. And as we were saying before about buying a new pair of shoes, getting a new hairdo, we all know that if you don't like the shoes or they give you blisters, you either don't wear them or you take them back. Unfortunately, when you've had your breasts done, you can't take them back. And I think that is a very important difference that we are in danger of losing here. And a lot of that comes down to the advertising and the marketing of the operations and the procedures.
The adverts certainly simplify the procedure, because what you see is a beautiful woman with a great pair of breasts. You don't see what she'll have to go through to achieve that look. The fact that that she'll be under anaesthetic, that the chest will be cut open, there may be complications later on. We've seen the PIP scandal. So the adverts sell you an ideal of perfection. You too could look like this girl. They make it simple.
While the cosmetic procedures industry may be in for a nip and tuck of its own, in the meantime, it's up to consumers to make informed decisions.
None of us would mind you asking, can we see your certificates? Can you show us where you trained, or can you show us your insurance?
This is a medical issue. It's not just a fun pastime. And I think that it has made people think a little bit more carefully about what we do to our bodies and who we allow to undertake invasive procedures. I think we now just need to make sure the information is in place, that choice is in place, and that actually the regulation is there underpinning it where necessary, so that people can make safe decisions about their bodies.
Think of it as if you're having, I don't know, a knee replacement or something, or an eye operation. It's still a part of your body. Cosmetic is a very, very misleading word in this context. Think about surgery, not cosmetic, in that phrase.